As far as dental implants are concerned, the process is simple. It's a screw that goes in place of a root. So simple replacement, 1-to-1 usually. Doctors make it very complicated and make it sound all fancy. But for a patient, all that matters is they're getting a tooth back that they lost. So an implant is a replacement for their lost tooth. That's as simple as it can be. Mainly it's for prevention. It's to prevent issues down the line. It's to increase longevity of a patient, because some studies have found that patients without teeth live about 10 years shorter compared to their peers that have teeth. So we do increase patients' longevity, but quality of life. Quality definitely increases. I mean, if you think about somebody that has to mush their food every day, is that a good nutrition? I don't think so. As far as our technology right now is concerned, they're the best replacement for a tooth. Tooth is still great. It's one of the things that we want to keep. But once the tooth is gone, implant is the second best choice. By having that tooth quickly replaced, we don't lose bone, we don't lose facial aesthetics, we don't lose the smile. That's all we care about, right? And then functionality, yeah, you can chew better, guaranteed. We welcome all patients at Royal Dental Care, specifically those that find the need to replace their missing tooth with an implant. We do thousands of these per year, and we have the experience, the expertise, the technology and equipment to make that process happen easier, faster, and definitely more economical.